why would somebody or why should somebody choose chiropractic care if they're having pain? Like let's say you hurt your knee. You play sports, you hurt your knee. Okay, first thing you might think of, I need a physical therapist. Okay, so why should somebody consider, before enrolling in physical therapy, why should they consider chiropractic care versus physical therapy?
It's totally a personal choice. There's obviously the belief that if I have pain here, I have to treat here because that's where the pain's coming from.
Okay.
And that's fine. There's nothing wrong or faulty at all. Physical therapy absolutely has its needs. I have plenty of patients that I recommend and go to physical therapy. I've gone myself. It absolutely does its part for people who are looking for a more whole and wellness in holistic standpoint of like, okay, yes, my knee hurts. Yeah, I'm like, what else is going on? Right? Like there are strings that connect that we don't always see because we're just living in our bodies and we are surviving most of the time, day to day. Most of the time, we're in pretty high sympathetic, which is our fight flight response, where we are perceiving danger in all kinds of different ways. And even some ways that we've just been programmed since we were young, of we didn't have all the means to grow up well. Maybe we grew up in poverty. Maybe we grew up with a, you know, very distant mother or father that we had to feel like we had to earn love from, or, all these different things that turn on that part of the nervous system. And so I'm being really elementary in the like turn on, turn off of it. Our nervous system doesn't exactly work that way, but what happens are the signals go and we say, we got to get out of here. We got to fight, flight, freeze. And there's, other deviations of that, but just really basic fight, flight, freeze.
Mhm.
And then our body will choose one. And then each and every time there's some kind of response, our body goes through that loop and it turns it on. And then we release cortisol, we release all these stress hormones, increase inflammation, increase, or decrease our affinity to be able to heal from injuries, being able
Mhm.
to self-regulate, being able to self-heal. And then ultimately, as we go through life, we'll encounter different symptoms, different things of that kind of cascade of stuff. And there's also, again, people can choose whatever they feel more affinity towards. I would just say make sure that they're taking care of you and they have your best interest at heart. You can't lose in that regard. And if certain injuries keep popping up, if certain symptoms keep popping up and you keep going like, why can't I heal from this? Why can't there ever be like a light at the end of this tunnel? Like what is going on? Like you really need to ask yourself, like, what is really going on?
Uh-huh.
Because a lot of times when you're in that mode and when our systems are so attuned to such a high sympathetic level, we think it's normal because just because 90, percent of the population is at such a heightened awareness state that it takes so much for us to feel anything.